Proteasome inhibitors are a group of drugs that are mostly used in treatment of multiple myeloma. And I think that brings an interesting concept to the field of cardio-oncology, where we tend to focus a lot on the diagnosis of cardiotoxicity. I think it's important to mention that multiple myeloma patients tend to be patients with a lot of pre-existing cardiovascular risk factors. Today, screening for cardiovascular function or cardiac function in forms of doing an echocardiogram to assess left ventricular ejection fraction is not indicated for either of the bortezomib or carfilzomib, which are the two most commonly used proteasome inhibitors. And that brings some challenges. That means that we mostly learn about the incidence of the cardiotoxicity when symptoms occur. So we mostly learn from the case series when we have a patient with symptoms of heart failure presenting. So we may be seeing the tip of the iceberg. The second very important question, which we don't know, is what is the role of pre-existing cardiovascular risk factors in development of symptoms and heart failure. Heart failure, as I mentioned, is an important way of presentation. Patients get treated for it. Typically, patients who develop heart failure, which is attributed to either bortezomib or more frequently carfilzomib, would not be re-challenged. But I have to say that sometimes one does need to push a step forward and try to exclude other causes, because in a patient with multiple myeloma, they may be there. One important phenotype to think about in a small group of patients with multiple myeloma, we have to think of cardiac amyloidosis. It's a light chain disease in these patients, and it's one of the diseases where if you don't think about it, you will not diagnose it. So my word of caution for this group of drugs, if the patient does present, I would try to treat cardiovascular risk factors, specifically hypertension, coronary artery disease. If the patient does present with symptoms of heart failure, try to exclude other causes, and for us as a group and in general to try to start early and identify what is the baseline cardiovascular risk in these patients, what is the baseline cardiac function. If we knew that, sometimes these questions will be easier to answer afterwards. And with that, I did want to put a pledge for I believe that the more platforms for discussion with oncologists in the room is needed to better understand how to approach a patient with multiple myeloma who needs a proteasome inhibitor and perhaps has cardiovascular risk factors or develops heart failure. We do need to be in the same room to start advancing this discussion. And as I'm really proud and privileged to lead a group within American College of Cardiology, and we've started a live course to discuss specifically cardiovascular outcomes and toxicities in cardiovascular management of oncology patients. At our live course, we had 2 live courses in 2017 and 18, and the next opportunity to participate in that discussion is January 25 and 27 in Washington, D.C.